first after I intro. Well, hello everyone, and welcome to another episode of The Doctors Are in the House. I am here today with Dr. Chike Obioha of St. Richard's Clinic, and we are going to have a wonderful discussion for you today. We are going to be discussing hyperbaric oxygen therapy. And so before we get started, I just want to briefly play a quick advertisement. So hang tight. We'll be right back. We're having a little difficulty putting our video on stage. Just give me 1 second.
Foster Road in Mason, with decades of wound care experience. In addition to treating work-related injuries,
I'm going to restart that.
do you have an open, non-healing wound from surgical treatment, bed sore, diabetes, or poor circulation, and you've been told to have your foot or leg amputated due to a bone infection? Don't you really deserve a second opinion? You may want a consultation with a doctor at St. Richard's Clinic on Socialville Foster Road in Mason, with decades of wound care experience. In addition to treating work-related injuries, St. Richard's Clinic also provides neighborly primary and urgent care services, with scheduled appointments, walk-ins, and telehealth visits. St. Richard's Clinic is currently accepting new patients and accepts most health insurance plans. St. Richard's Clinic is open Monday through Friday, 9 to 5, and Saturday by appointment. Schedule with St. Richard's Clinic online or call 513-306-4910. That's 513-306-4910.
Well, hello, Dr. Obioha.
Hello, good evening.
Good evening, and thank you again for being here with us tonight. We are titling tonight's session Healing Under Pressure, the Power of Hyperbaric Oxygen Therapy at St. Richard's Clinic.
Right. Yeah.
So let me ask you, Dr. Obioha, for those who may be hearing about hyperbaric oxygen therapy for the first time, can you explain what it is and how it works?
Well, hyperbaric just simply a treatment that requires you to be put in a chamber that gives you 100% oxygen to breathe at a high pressure, usually between 1.5 to 3 atmospheres of pressure. And the idea is to increase how much oxygen that your body gets into the tissues. And by doing that, you increase the efficiency of their energy generation through ATP. For those of us who've heard about the Krebs cycle in chemistry or biochemistry, yeah, that process is magnified when you have when you have increased oxygen available to the tissues. The beauty of the hyperbaric chamber is that even when the tissue doesn't have good blood flow, the ability of the pressure to dissolve the oxygen in the body fluid. Keep in mind, most individuals have up to 60% of their body weight being water. So you dissolve oxygen in that amount of your body weight, then oxygen is available to the tissues, and the tissues can now burn up glucose more effectively and actually recover from injuries like radiation-induced injuries or chronic wounds and completely recover. People have talked about it in anti-aging. As we go along, I'll try and mention some of the evolving ideas in terms of use of hyperbaric oxygen for treatment. And then we'll look also at those ones that have been established that currently established care that is compensated by health insurance. Yeah.
So, Dr. Obioha, you used a big word, chamber. And when you said chamber, that scared me a little bit. And so I don't know how many people who are listening are thinking the same thing I'm thinking. What do you mean by chamber? So I'm going to Is it okay if I show a picture of what this
Picture.
thing looks like? Yeah, let's
Yes,
pull it
please.
up.
So
Okay,
there's
so
a chamber just behind me there. There are different manufacturers of chamber, and this particular one is made by the group named I Live, who have me using their product at this point. But I have had the experience of using other hyperbaric chambers. The idea of the chamber is to have a pressurized system where you can increase pressure, increase the concentration of oxygen, and generate the environment that is needed for you to get a treatment. Most of the treatment lasts somewhere between 60 and 120 minutes. And then if you can sustain that, it's been known that the oxygen concentration can rise up to 1500 to 2000 millimeters of mercury of oxygen concentration in the tissues. Now, if the tissues can get that amount of oxygen, they're able to sustain it after you've had a treatment of about 1 to 2 hours. For beyond the treatment, they can sustain that amount of pressure for up to 3 hours. Has been noted. And if you continue with that treatment, most people, like I'm experiencing wound care. I've used it quite a bit in wound care, but it appears to be an exciting treatment that is beginning to find its way in several other medical challenges that has challenged us in recent times. So we'll try and mention that in the course of this conversation.
so Dr. Obioha, so is this a treatment that I can get at any physician's office? This hyperbaric oxygen treatment?
Honestly, that's an important question. In this Ohio area, most of the chambers are available in hospital-based wound care centers. Almost all the big hospitals have an oxygen chamber, but I have acquired one for my clinic. I just feel like I needed to be able to kind of exert the best wound care that I can provide for my patients. Yeah, I think at this point I don't know any other private clinic that owns a hyperbaric chamber besides myself in this area of
And when you say
Ohio and the United States. Yeah,
in Ohio in this region,
yeah,
okay.
in this region. Yeah.
So it makes your clinic kind of unique that you have one of these chambers there.
Yeah,
So
actually, for me, I saw it from from a functional point of view. Most of the hospital-based clinics have a scheduled staff, scheduled time for their treatment, and those times fall in the time some, like people who work. That's the time they go to work. So if you have a treatment that's going to last for a period of 4 weeks, for instance, you probably have to leave or find a way to adjust your schedule at work if it's possible. But my treatment can accommodate, off hours for those who want to keep their work. Like I said at the beginning of our series of conversation, my idea has always been to find a way to keep you working while you get the best care that you can, especially for wounds, which is one of the chronic problems most people have in this environment that has up to 60% obese and high morbidity due to diabetes.
okay, wonderful.
Yeah.
And so, Dr. Obioha, why does breathing pure oxygen under pressure have such a powerful effect on the body's ability to heal?
That's a good question. Just like you put gasoline in your car and you expect it to just get the engine moving and you can drive distances, the body's own gasoline system is glucose that is combusted by oxygen. So, what has become apparent to us is that the oxygen we breathe. We've always known the oxygen we breathe from the environment just constitutes about 12% of the gases that are in the air that we breathe. But we now science have discovered. I don't want to go into the history a little bit. It may just take us out of. But science has discovered that if you increase the concentration of oxygen and then pressurize it to get into the system, you kind of change the balance that exists between the dissolved oxygen in the blood circulation and the amount that is picked up by hemoglobin, that's a major component of red blood cells. So as me and you are talking right now, the major transporter of oxygen in your body system is hemoglobin, while a smaller portion, somewhere less than 5%, is transported by the dissolution of oxygen in the plasma. And then if you pressurize oxygen, there are certain laws that we've learned in our chemistry and physics as in our younger days. At least Boyle's law is one of them, and Henry's law is one of them. But like I try to explain to most of my patients, the laws that govern gases come to play if you get into the oxygen chamber. If you increase the pressure around different gas molecules, you're going to make those molecules come together, so they lose the volume. Likewise, if you increase the temperature around those, they tend to pick up a higher volume. So temperature, pressure affect the volume of gases. The one described by Boyle was the relationship to the pressure. And that's what is used to treat situations where you have embolism, people who have decompression injuries, and what they've described in medical terms as debents. So that principle in gas manipulation is used to, kind of knock off a bubble of air that is floating in circulation that can block off the circulation and cause ischemia in distal tissues. Now that is the Boyle's law. But Henry's law is the one that's most fascinating. That's the one that seemed to kind of be the main dynamite in the room. That's the one that describes how if you pressurize the gases, you can increase the rate at which they dissolve in liquids. And that is what this treatment actually targets. It tries to increase the amount of oxygen that is dissolved in the fluid that is transported both in the, so you have the intracellular and extracellular fluid, if you know a little bit of biology. And all that fluid get oxygen dissolved in them and ultimately gets the tissue. So even if there is no perfusion to that tissue, if you have patient has had a surgery and then the surgery, like a skin flap, is failed because there's no blood flow going to that skin flap. If you put the patient in oxygen, the oxygen is able, in the oxygen chamber, you're able to generate oxygen to that tissue and actually save the tissue and encourage it to generate new blood flow that is not the one that is described anatomically. And that is huge for patients who would have lost maybe a limb or a major part of a limb due to that kind of situation arising. So this is a big deal, but it doesn't come without a cost or without some risk. And we're going to try to delve into those risks and how we manage them in trying to provide treatment for patients. I've been privileged to manage patients get this treatment over more than 6-year period. So I have quite at the back of my neck a little bit of experience in how to navigate the treatment and
Wonderful.
prevent people, getting harmed by the treatment. Just like almost every other treatment we have in medical field, those who get anti-cancer treatments have the risks that come with it. You just have to make sure you manage it so that the patient gets the maximum benefit from the treatment and minimal de-benefit, bad part of the treatment. That's kind of the same thing with the oxygen treatment.
So what makes hyperbaric medicine different from other oxygen-based or alternative medicines?
Well, it is unique. It is unique in itself. It's just a unique type of treatment where, most other things that you get in similar scenario will be more of investigative modalities. Like you want to get a CT scan or MRI, you get into a room or chamber that subjects you to that kind of thing. But the beauty of the oxygen treatment is if you can get over the anxiety of being in a chamber, which is almost like being in an airplane. If you can get over the anxiety of, the claustrophobia of being alone and thinking that something's going to happen to you, if you can get over that and just relax and enjoy the oxygen, you actually come out looking younger than you were. I make a joke to my patients that you get in there and come out looking younger. But the anti-aging is actually making a lot of inroad into this treatment. Yeah, for those who want to feel like they're younger. But the reality that we never knew until more recent time is that a sick tissue, a sick cell, when you maximize its energy potential by giving it so much oxygen, it actually can fight off the sickness and recover. Before, previously, people were afraid of using the hyperbaric for cancer patients. In fact, one of the challenges I had when I first moved to Ohio, I was invited to what seemed like an ethical meeting at the hospital I worked, and some outdated physician was questioning my recommending the hyperbaric oxygen treatment for a patient who was receiving radiation treatment for cancer, because as far as he knew, he couldn't use it in that cancer situation. His thought was that it will make the cancer cells, amplify their growth. But the studies have shown that to be not true, and he wasn't current at the time he made that move, and his colleagues at the meeting were the ones who told him that this guy knows what he's talking about. That was kind of my first impression when I first started working in a hospital here in Ohio. Just different people. The truth is the knowledge is still evolving. The indications for treatment are still evolving. In fact, just before I left the hospital, one of my colleagues had called me and said his own son had autism, and he had heard that people with autism benefit from this oxygen treatment. I told him, yes, that's one of those areas that is still evolving. The thing with autism is a spectrum of illness. You got to figure out who benefits and who doesn't, and that is not quite clear. And I was trying to let him know that I wasn't sure that any insurance will cover that treatment for his autistic child. Man, it's quite a pricey treatment, in all fairness. Yeah, so that was that conversation. But yeah, it is evolving in terms of what we can use it for. Now, like I mentioned, cancer, just nobody will take a cancer patient and put in oxygen and say that the oxygen will treat the cancer. No. But the truth was that there was a time it was a no-no for a cancer patient to get into the oxygen treatment. But today they've actually realized that that's not right, that you actually benefit, to some extent in your cancer if you got opportunity to get a hyperbaric oxygen treatment. And
So,
like I said, the insurance will not cover a treatment, that is not one of the ones that are defined in terms of the indications for the treatment.
wonderful. Okay, so you talked about a little bit, Dr. Obioha, about how if people can get over the fear of being in a chamber, so to speak.
Yeah,
Can you walk through what?
it is petrified. You get petrified by the initial thought of it. For most of the patients I have had to treat, when they look at the whole thing, they're like, "I'm gonna get in there," but in all fairness, I remember when I started out here in Ohio, the Hamilton area of Ohio, there were very few people who got the treatment. But by the time I left there, it was routine. Almost every day we had a whole session filled with people who were now more. In fact, one of my experiences living there was a gentleman who had a brain surgery and kept having this recurrent swelling in the brain. And his physician, a neurosurgeon, called me and said, "Hey, he heard that this is." I told him it's still evolving. If his insurance is an evolving area of interest in terms of success with hyperbaric. I wasn't sure if his insurance was going to cover it, but the insurance said yes, they were going to pay for it, and he got the treatment and actually got better. In fact, he got better after we completed the first cycle of treatment. They insisted on getting additional treatments. I left the place before he completed his treatment, but based on the imagings that were done, I was really surprised by the kind of success that they had with the treatment. It is a fascinating treatment. I've had the most. In fact, my experience with it was when I first did my residency in University of Iowa, in Iowa City, in the state of Iowa. That was the first time I went there. But they had what they called a multi-chamber system, where multiple people get in there and then they have to wear the hood or mask to get the high oxygen. When I came to Ohio, my experience was with the single chamber, where they in this facility where I work. There are some places in Ohio that have the multi-place chamber. But the way I worked was a single chamber, and that's what I have in my office, where you just get in there and you just kind of bear the treatment on your own and get the goodies out of it. But it is fascinating what I've seen it do in terms of being able to get people who have wounds that didn't have a chance at all at healing. And then the more common one is the diabetic foot ulcers. You have some real bad diabetic ulcers that are not healing, and you put the patient in there, and you'll be amazed how, over a 4-week period, a wound that has lasted for years now succumbs to the treatment. As long as you optimize the wound, like like I usually do. I'm an expert in wound care. I try to make sure that you don't leave the wound and expect that whatever you throw at it will make it heal. You have to optimize the wound and then give it some more juice that will ultimately bring it to its resolution. Then by my experience.
Can you walk us through what a typical HBOT session looks and feels like for a patient?
Well, first you have to have the physician who is going to first pick out the reason why you're getting in the chamber, and then make an assessment of whether you are capable of getting in that chamber and safely getting the treatment and getting out. Now, there are some chronic illnesses that really can challenge that treatment. There are people with severe forms of COPD who have, like blebs in their lung tissue, some like big bolus of air. Such air pockets in their lungs actually undergo the same pressure changes that the chamber actually subjects the individual to. Some of them can rupture, and then you can have a situation called a pneumothorax.
Mm.
That can be a life-threatening situation. So most times when you have a COPD, we'll send a patient to a pulmonologist and say, "Hey, look at this individual and see if he can be able to, survive this treatment." So that is one scenario when there are other people who have severe forms of congestive heart failure. Keep in mind the heart is pumping at a particular pressure, and if you increase the pressure around it, it means you're adding more work to the heart. So somebody can actually decompensate, in their already, maybe they have some form of compensation in their heart failure. They can undergo an acute decompensation, and that would be like a real medical emergency. People who've had seizures, you want to know if they have a seizure history. So all those kind of things. Some forms of chemotherapeutic treatment, if you've had that, most of such patients may not be good candidates to get into the chamber. Other
Mm.
things we want to look at is, has the person gone deep diving in the sea before coming, or has air travels? We try to avoid that around the treatment, either before or afterwards, so that you don't generate another problem. Like we've discussed, we mentioned earlier, decompression injuries can arise. You can have an air bubble just generating the circulation and block off a vessel, cause limb ischemia or limb loss, just because of not taking adequate history and preparing the individuals right. So that is a key part of the whole assessment. And then, in the United States, there are set criteria. I'll just mention some of them, the acute ones. You have acute air and gas embolism, decompression sickness, carbon monoxide poisoning, cyanide poisoning, gas gangrene, crush injury, compartment syndromes. If the surgeons will let that be, acute traumatic ischemia, severe anemia, where transfusion is impossible. Those are people who acutely can benefit from hyperbaric oxygen. Of course, acute arterial insufficiency and things like central retinal occlusion. Those are patients that, if you put them in oxygen, the oxygen can rescue the tissue that would have died otherwise, or apply the Boyle's law and release the embolus, kind of melt it away and allow circulation to be reestablished in that area. So those are the acute. In more chronic or subacute situations, you have the diabetic ulcers we mentioned, the ones who are like what we call the Wagner grade 3, where they have osteomyelitis. Ohio is a common practice for people to cut somebody's limb off in the name of
Mm.
osteomyelitis. And I preach strongly against that. I just feel like getting somebody's limb taken off, or making somebody a cripple, it deserves a little more chance than that, especially in an environment where we are today, where we have all these things available to us and insurance actually pays for it. So give that person a chance to get a treatment that may rescue that limb temporarily or potentially permanently, and before you kind of make up your mind to go cut the limb off, because cutting the limb off is a permanent thing. You're not going to cut the limb off and patch it back up. You understand? So you're going to change the person's status and lifestyle if you do that. And somehow, I don't know, I just feel like most people lose their limbs without having enough knowledge about opportunities that are there to save the limb. And that's kind of things I have tried to make sure people are aware of. Then chronic refractory osteomyelitis that just wouldn't go away. It keeps going. Another option of treatment is like you give them oxygen and see if the tissue can recover. Soft tissue radionecrosis. People who've had exposure to radiation treatment for one reason or the other. They had a prostate cancer and they had radiation there, and they involved the tissues around there, like the blood, and they start bleeding. Those are people who benefit from it. And then osteonecrosis, people who have mandibular osteonecrosis are another group of people, most times from skin cancer treatment, in the head and neck area. So those
Dr.
are patients.
I'm going to just stop you for a second, because you've talked a lot about the various treatments, that the various things that hyperbaric oxygen therapy can treat. But from a medical standpoint, what's actually happening inside the body during a hyperbaric session?
Inside the body, you are saturating the body fluids with oxygen. By that way, you are bypassing the circulation, more like, to get oxygen to the tissues. So the tissues don't have to rely on blood circulation as we know it to get oxygen. So that increases the tissue oxygen saturation. By increasing the tissue
is going throughout the body.
Yes, you're pressurized. So by the Henry's law is telling us that if you increase the pressure, you increase the ability of the gas to dissolve in fluid. Your body is made up, female, you are probably 55% of you is water. When you weigh yourself in the morning, you just 55% of that weight is just water. You understand? And then you pressurize oxygen into you. By doing that, you increase how much oxygen gets dissolved in that water that is 55% of your body weight. You understand? And it can get 3 to 4 times fold. That means increase the amount of dissolved oxygen in the fluid. And that is what drives the oxygen directly into the cells. They don't now have to rely on that hemoglobin mechanism that runs inside the blood tubes, the blood vessels that gets to the capillaries and line up and try to deliver oxygen to the tissue. They don't have to rely on that mechanism anymore. They can just get. That's why even when there is no blood flow, even when there is tissue ischemia, as we call it, when the blood flow has been terminated, the patient in the oxygen chamber is still able to breathe the tissues and not let them die. You understand? The challenge is, it would have been wonderful. Just imagine if someone had a stroke, you just throw him in there, and the tissue, instead of the stroke causing I remember one of my colleagues is a cardiologist, and he asked me, why are we wasting time with people who have a heart attack, wasting their, why just put them in, I'm not explaining that there are consequences of putting them under that kind of high pressure. The heart that has suffered an ischemia may not be able to survive the external pressure you're trying to put to it to be able to get the oxygen to the tissue. I don't know if you understand. You have to kind of weigh the pros and cons to be able to say, hey, you want to try this as a treatment. So the life-saving measures are still better, at least at as much as we know today. Those percutaneous interventions to help patients with acute MI are much more reliable than trying to throw them in the oxygen chamber and pressurize the system. You probably make that heart give up.
So can you explain,
as well? Sorry?
Can you explain how HBOT supports cell regeneration? How's it reduce inflammation and stimulate angiogenesis?
Angiogenesis. Okay.
Thank you. Yeah, angiogenesis. Thank you.
Okay, that takes us to some molecular biology knowledge. So what happens is when you saturate this tissue, the oxygen tension there, it causes some kind of vasoconstriction. Now, by causing vasoconstriction, you minimize swelling that ordinarily would have been a problem for injured tissue. So you mop up that, you save the tissues from dying. So by their surviving, they are able to release, any chemicals that will help them generate new blood flow. That's the angiogenesis. I can start mentioning things like VEGF and all the interleukins that are involved, but that makes this conversation more of a medical conversation
Yeah,
than a public conversation.
definitely not too much.
I just want to see how I can keep it a public conversation as
I
much as possible.
appreciate that.
So,
I appreciate that. I'm a doctor, but not that
if I
kind
start
of.
mentioning things like that, I think it will just generate frustration on the part of the audience. But the reality is, yes, if you save the tissue, actually, let me go a little bit into the history. The history dates way back, when people tried to figure out, this whole oxygen thing. But it became much more knowledge was picked up when the Germans kind of started doing some experiments around it. And the interesting experiment I read was about a gentleman who decided to get all the blood out of pigs and then infuse them with saline and then give them high oxygen. And some of the pigs had no blood in them and lived up to 7 days. At least, I think his study ended at the end of 7 days. He didn't go beyond that before he got rid of the animals. But he was fascinated that even without blood at all, some animals were able to survive in a high oxygen environment. And that's when he started looking at the reason why they would have survived and realized that the body is better than we realize. The body economics is actually much better than we realize. We're just using a portion of it, to function. And the more you learn about it, you'll be fascinated at what reserves that we actually have in almost every system in the body. This oxygen one is one of those eye openers. Yeah.
So, Dr. Obioha, I'm going to ask you another question before we go to a commercial break.
Okay.
So how does oxygen pressure affect the immune system and the body's ability to fight off infection?
Wow, that's a big dollar question. The truth is, when you study the organisms that cause infection, you realize that some bacteria are called anaerobic bacteria. One of the common anaerobic bacteria I knew as a young student in medical school was the one that caused tetanus. Tetanus was a common thing in the environment where I grew up. Tetanus is the Clostridium tetani. That Clostridium is an anaerobic organism. It thrives where there is no oxygen. So, imagine what happens to the Clostridium bacteria when the environment is saturated with oxygen. It will just definitely kill it off. You understand? Mm-hmm. And there are other bacteria then for those bacteria that thrive even in the presence of oxygen, the high oxygen generates. There is what we call the molecular oxygen, or that it's used to generate oxygen radicals that are utilized by the bacteria that fights off infection, and that is kind of amplified under this hyperbaric situation. So the immune system is actually, given an additional hand by having this treatment. Now, one of the big challenges I've known as a student was the treatment of osteomyelitis. When I was a student, the statement was once an osteo, always an osteo. So most people had this palliative way of treating osteomyelitis. Then they try to get as much of antibiotics to the tissue as much as possible, and the success was minimal. Today, most people with osteomyelitis get combination of antibiotic treatment and hyperbaric oxygen treatment, and they're able to wrestle the infection out of their system, even if it's temporary. You understand? So that the surgery is no longer the landmark treatment for this problem, as it used to be before. So yeah, the ability of the tissue to fight off infection is highly amplified when you increase the tissue oxygen saturation. That's what we're saying.
Wonderful. Thank you for that. I'm going to just take a commercial break for a second. If your audience can stay tuned, and we can play a quick commercial break.
Do you have an open, non-healing wound from surgical treatment? Bed sore, diabetes, or poor circulation? And you've been told to have your foot or leg amputated due to a bone infection? Don't you really deserve a second opinion? You may want a consultation with a doctor at St. Richard's Clinic on Socialville Foster Road in Mason. With decades of wound care experience, In addition to treating work-related injuries, St. Richard's Clinic also provides neighborly primary and urgent care services, with scheduled appointments, walk-ins, and telehealth visits. St. Richard's Clinic is currently accepting new patients and accepts most health insurance plans. St. Richard's Clinic is open Monday through Friday, 9 to 5, and Saturday by appointment. Schedule with St. Richard's Clinic online or call 513-306-4910. That's 513-306-4910.
All right, Dr. Obioha, we are back and we are talking about hyperbaric oxygen therapy today. And that is the chamber back there in the back for those who were not on when we first started this discussion. And Dr. Obioha has joined us to talk a little bit about how someone can benefit from hyperbaric oxygen therapy treatment. And so, Dr. Obioha, let me ask you, is there a scientific basis for HBOT improving mitochondrial or brain function? If so, what are we seeing in research or imaging studies?
So the success in brain, traumatic brain injury, for instance, and other brain-related challenges has been kind of lopsided. It's not clear-cut. You have success in one study and then poor success in the other. So we're just looking at the numbers to see where the dice may ultimately fall. When you have a much higher population of people, the question to ask is really how many people have gotten this treatment with that particular problem to be able to generate enough numbers for you to get a more reasonable data analysis that you can more accurately extrapolate to a larger population. So that's kind of the challenge there. It's not a treatment that is easily available. It's not a treatment that most people want to venture into. Like I said, my experience where it worked, there was an evolution of, I think the problem with the treatment from my best perception of it was people didn't know about it, people are freaked out about it, and even the physicians were not putting in the effort to explain to the patients the benefits and then the effort that is made to make sure they go into the treatment and get out safely. A lot has been done to improve safety. I know there are a few incidences where people had the worst case scenario where fire broke out in the chamber, but it's not popular at all. It's minuscule, if I want to put that. And then as days go on, I belong to the American Undersea and Hyperbaric Medical Society. I made an effort to join that society just to improve my knowledge of hyperbaric treatment and wound care. And most people who are venturing to provide that kind of service, I will encourage them to get into that society and benefit from it as well, because it is what you know that you can offer someone. That society, they don't have as much representation among providers as you would anticipate. I'm not saying that those who join other societies are not that provide some intellectual basis for care are not doing a good job, but the knowledge is out there. The opportunity to gain it is out there, and my effort is to be better and encourage others who provide service to also strive for the same success in their care that they provide.
So Dr. Obioha, first of all, let me thank you. I appreciate you sharing about this treatment today and letting us know about it, because the only time I'd ever heard of such a treatment, and I didn't even know it was treatment, was with Michael Jackson. I know he used to sleep in one of these chambers.
Yeah, but he just wanted to live forever, So
and I guess
I remain young forever. Yeah, it was a vision. But you can imagine at the time he was doing that, how much knowledge we have, compared to today. I think I mentioned to you Stevie Wonder. Stevie Wonder was not born blind. He actually had oxygen toxicity to his eyes as a kid. Those are evolution of medical treatment when oxygen was being given to improve the mortality rate among kids. And he benefited from that by staying alive. But the amount of oxygen was given caused him his blindness, to the best of my knowledge,
Mhm.
and yeah, and that was probably the price at that time. But today, that is no longer popular. More kids are benefiting from oxygen treatment in the hospitals without losing their sight, because we have a better understanding of how to manage that situation. Just like when Michael Jackson had his oxygen, he benefited from it, but the knowledge is much more better today in terms of being able to get people to have the treatment and
So,
benefit from it. And yeah.
so Dr. Obioha, I know you are having a holiday gathering.
Okay. Yeah, I am.
I wanted to. So what's gonna be happening at this holiday gathering, and who can attend?
Yeah, they honestly, the environment, anybody in the environment who can make out time between 2 and 5 p.m., who wants to benefit from an adult clinic should be able to come in and see what we do. The ad said, we are currently taking in new patients. We provide urgent care services. We provide primary care services. More importantly, we provide preventive medicine and occupational medicine services as specialty, and we also provide wound care services as specialty. So wound care, every facet of wound care, I provide wound care on a mobile basis. I also provide in the clinic, and I have an oxygen chamber to assist with the care that I provide. Now, the occupational medicine, I'm board certified in it, and I provide. I try to get people to get out and do and work, and work compensably, as we can see the societal, our societal support structure has become a political football in recent times. I mean, today we listen to SNAP benefit who needs SNAP to just have food on the table, not being able to get it just because of the political issues that we are dealing with in our times.
Mhm.
So yeah, so the things are changing rapidly, and we're just trying to make sure we provide our own support of the society with the medical knowledge and expertise that we have. So
And so,
you're invited to come in there and see what we do. We'll show you around the clinic and entertain you a little bit during that time. You people will get a free blood pressure check, maybe sugar check, and see how healthy they are moving around. I have to mention such blood pressure measurements are not the best because it's done randomly. But if you have a high one, it may be necessary to talk a little bit more about it to see if we can reevaluate your blood pressure and get a more accurate understanding of your blood pressure situation. If you
and
haven't been
so,
checking yourself. Hmm?
so you're gonna be doing just some blood pressure screenings.
Yes.
Um, I think I have an agenda for that day. Let me
Okay.
put that up just so that people can see some of the other things that are going to be happening on that day. I don't
Okay.
know how clear that is, but I will go ahead and mention it. So there's going to be some raffles, and people will be able to take a tour of the facility as well as a mini talk.
Yeah.
Don't ignore that cut. You're going to be doing a
I'll be,
discussion.
I'll be, yeah, I'll be talking to people about some of the things that I've had the privilege of discussing in this ed, program that we've had, and lot more and lot more. Just to improve the life expectancy is better, but challenges are beginning to we're beginning to be challenged in our social support structures in recent times, and it just keeps playing out from one issue to the other. At least over the time we've had this conversation, and I feel like if you can keep yourself healthy, keep yourself from the illnesses that make it impossible for you to function. Yeah, if you do have challenges at work, we can help with those. Yeah, that's kind of what our mission is here. Mm.
So, Dr. Obioha, I love the idea of being able to come in and see this chamber thing here. I think it would be wonderful to see it in person. And let me ask you about this chamber. Now, are there people, are you going to be watching to make sure everything goes okay? Are there people when I'm in that chamber? Is there a way to make sure that none of those tragic things happen that we talked about today?
Yeah. So yeah, I was talking about briefly. I tried to mention some of the things about preparing to get in the chamber. So there are certain demands of you to get in the chamber. If you're anxious, who can control your anxiety? But we need you, one, not to wear any cosmetics, avoid painting your nails, avoid petroleum jelly cream. Just have a good shower and try not to put makeups. And then
Oh
you
my
come in.
goodness, Dr. Obioha, I've got to come in there with no makeup, no
Avoid
fingernails.
any metals. Avoid any metals. You're not gonna have any metal on you to get into that chamber,
So,
including your glasses. If you, if honestly, and then you have to, be bare of outfit and be wearing only what we give you in the clinic, which is 100% cotton. All this is just to minimize or eliminate the electrostatic potential of these things that you can carry in there.
oh, okay.
You don't expect to. You have a light meal the day before. We check your blood sugar. I forgot to mention about the blood sugar. Now, the the price that you pay when your body is become the dynamite burning is that your sugar is being burnt up at the rate because the oxygen is there and the body system is just kind of overacting in order to give these cells the ability to fight off the challenge. So you can actually use up so much sugar that the sugar goes down. It's more apparent in a diabetic who has a physician that has tried to put a bench at how much sugar they want, what we call the glycemic control. So imagine a diabetic is seeing a physician who is managing their sugar. He has put in place certain modalities to make sure that your sugar doesn't go this high or that high. That kind of sugar can easily be burnt off by the hyperbaric oxygen treatment. So we check the sugar, make sure you have enough sugar in there to be able to last the 2 hours. And we check it right after you come out to make sure that you still have enough and then try to catch up on those. And then those who are poorly controlled in their diabetes, we try to make sure we get a better control of it. Those are things, because if the sugar is just fluctuating back and forth, and you throw the patient in that chamber, you don't know, and the patient can actually have hypoglycemia in there and start having seizures from it, or even have altered consciousness. So we don't want to put a patient there that you can't speak to and know how they are reacting to the environment to know when to get them out of it. So those are some few things I just, but the whole details are in the process. If you come in, we'll walk you through the step by step criteria, the expectations, and what you should and should not do, to get into the chamber, and what you should and should not do after you come out of the chamber. Yeah.
So, what are
So,
the main medical conditions that the FDA currently approves HBOT for?
yeah, I talked about the acute conditions that are established. If you have cyanide poisoning today, yeah, I'll throw you in the chamber. Actually, a set treatment criteria for that. If you have carbon monoxide exposure and poisoning, yes, you can get benefit from that. Persons who have what we call decompression, decompression sickness, or the bands can benefit from that. Acute air and gas embolism will benefit from that. Gas gangrene, I talked about. Arterial insufficiency and flap necrosis. Acutely, you can benefit from oxygen treatment and rescue the tissue. Acute arterial insufficiency, like central retinal artery occlusion, that could lead to blindness. You can also benefit from oxygen from that. Those are the acute conditions that are
Okay.
established treatments. Yeah.
Okay.
And there are chronic conditions, there's things that you have ongoing for a little bit of longer period of time, subacute and chronic conditions, refractory osteomyelitis, diabetic foot ulcers, soft tissue radionecrosis. I mentioned those that have a radiation injury from radiation treatment, osteoradionecrosis, compromised skin grafts and flap, chronic non-healing wounds, thermal burns. Then now come what we call the adjunctive or emerging indications. You discuss with the insurance and find out if they are willing to cover the patient for those. I've had a few scenarios where patient got refused, and some where they now people who have experienced a sudden sensory neural hearing loss can benefit from this kind of treatment. Neurologic injuries, generally traumatic brain injury, post-concussion syndromes. I told you about a patient who had had a brain surgery for, I think it was an aneurysm that he had a surgery for. The neurosurgeon called me and said that he kept having this swelling in the brain. They treated it with a lot of steroids and it improves and then it comes right back again. We'll give him a shot at the oxygen treatment. And he improved so much that he had repeated MRI images that showed that his swelling in the brain had actually improved. Now, I didn't know that before the treatment because it was one of those, those indications where it's not clear cut whether the patient was going to benefit from it or not. Then necrotizing soft tissue infections, you can have this as an adjunct to surgery. So somebody has an extensive area of soft tissue necrosis, the surgeon will just go on and clean up as much as he can. You throw the patient into the oxygen chamber and see if the oxygen can help recover some of the tissue and heal the areas that surgery has completely eliminated tissue. Those are some of the, then people talk about acute ischemic stroke. It's still experimental because you want to make sure that the patient who has stroke is able to talk to you. And then because if you can't talk, it's not fair to put the person in the oxygen chamber. You don't know what other experiences that he's going to have there that he won't be able to explain, and you don't expect to do that. So if a stroke patient is able to communicate and is still awake and is talking, he's not unconscious, it may not be a bad idea to get, especially if he's missed the window where you can do an acute a vascular intervention to improve the stroke. You can put him in a chamber and see how much of the brain tissue and swelling can be improved in terms of oxygenation of brain tissue and reduction of the swelling in the brain with the stroke, and see how much that will aid their recovery. Yeah, that is experimental, but it's still a reasonable, When I talked to you about my colleague, a cardiologist, who was asking me about that in the heart situation, I think the heart will be a little bit more difficult to deal with because the heart is pumping against the pressure, and you don't want to increase that pressure, especially when the heart is injured. So, yeah, but we may just find ways where a patient may get an initial intervention to improve the circulation in the heart, and then you put them in the chamber and see if some of the heart tissue that has been injured by by the poor circulation may improve their function with increased oxygenation of tissue. We don't know that at this point in our medical history. Maybe somebody may find something in the future that would, give credence to that thinking or approach to care. Yeah.
Well, Dr. Obioha, we are coming to the end of our session here, but I do want to mention to any physician that might be watching this that you are open to referrals.
Yeah.
And what about second opinions? Do you allow?
Second opinion is kind of the stock in trade. If you don't like what you're hearing, ask somebody else. Nobody will hold it against you to do that, especially with these diabetic ulcers and those that are being subjected to limb loss, which I think is a permanent solution to something that may benefit from some conservative approach to treatment. Yeah.
Wonderful. And so, Dr. Obioha, I see scrolling across the bottom of the screen here is how people might be able to reach you. They can reach you at St. Richard's Clinic at 513-306-4910, or they can go to your website at www.strichardsclinics with an S on the end.com, strichardsclinics.com. And so I just want to say thank you so much for being with us here to discuss HBOT treatment. And I think we need to have a part 2 of this discussion.
I think so too, because it's something that freaks people out. I think the more they hear about it, the more they are more welcome to it. Especially what we now do. Like if you were to get the treatment, for the 2 hours you're getting the treatment, I forgot to get to that part. a physician like me must be in the room where you're getting that treatment. If I'm in my clinic, I'll be the one looking at you through the treatment. Now, in most of the hospitals, there must be a trained nurse who is trained in this hyperbaric and has a certification that will be eye contact with you from start to finish of your treatment, and a physician in the building. In my clinic, I must be in the clinic supervising it to be able to get you to get the treatment. That's why we can offer of our treatment is, if the times, if your schedule conflicts with work, we can always make accommodation for that.
Okay,
At
so
least for
you
now.
can be
Yeah.
there after hours and on weekends
On
sometimes.
weekends, and yeah, you can just make
And
up
how long
enough
is the
treatment.
typical treatment,
It,
doc?
so most of the treatments for when it's wound related, most of the time will get up to 4 to 6 weeks of at least 5 days of weekly treatment. 5 days is Monday through Friday, but you can always have weekend treatment to make it up to 5 days. And in those 5 days, you should have 2 hour sessions of hyperbaric oxygen up to 2 atmospheres, which is what we provide in our clinic. And then
So,
you will be monitored by a physician who is taking care of the wound to see how you respond to the treatment, whether the wound is actually going away or not. And most of the times, in my hands, I see wounds just move away with the in making sure that we optimize the wound and give you the hyperbaric oxygen treatment. Yeah.
so Dr. Obioha, I wanted to again invite the public to. Is it okay if I invite people to your event?
Please do. We
Okay,
want people to be aware of what we're capable of doing in this environment.
wonderful,
We want
wonderful.
you to know what's available in your neighborhood that can make you better, healthier, and maybe even younger.
All right. So
Yeah,
at your word, Dr. Obioha, I'd like
yeah.
to invite everyone to St. Richard's Clinic on December the 6th,
Yeah.
Saturday, December 6th from 2 to 5 p.m. They can drop in anytime, I'm assuming. And you are invited then to a season of healing, hope, and giving gift of health.
Well, yeah,
And this is a grand opening and open house. And
yeah.
so stop by. You can stop by on that day, December 6th, from 2 to 5 p.m. at 4834 Socialville Foster Road, Suite 10 in Mason, Ohio. And there will be treats, holiday treats, and hors d'oeuvres, and all of those wonderful things. If anyone wants to RSVP for that event, you can scan the QR code right there on your screen, or you can call 513-306-4910 and just let Dr. Obioha's office know that you are RSVPing for the grand opening event. And that way he can order enough food. I'm going to be there and I'm coming, I'm bringing friends, and we're all going to come hungry, Dr. Obioha. So I
Thank
hope
you so much. I look forward to seeing all of you,
I
honestly, and
will
you're
be
welcome
there.
to see what we do. Okay.
Wonderful, wonderful,
All
wonderful. Well, thank you again for being with us today. And I look forward to having another conversation where we can talk about a little bit more about this hyperbaric oxygen treatment, um, and also share with the listening audience a little more about the treatment so we can get into some further discussion when you come back, Doc. So
Thank you so much for having me. I do appreciate the opportunity.
all
Mhm.
right. We'll look
Mhm.
forward to talking to you again soon.
Okay.
And bye bye, everyone. Thank you for
Yeah.
tuning in to Vision Works. The doctors are in the house, and we look forward to seeing you on our next live session.
Session.
So
Okay.
take care, everyone.
All right. Thank you.